We are back with Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Dr. Hassoun, hospitalizations increased across the country, but decreased here in Madison County. What could be causing that?
Yeah, and these are the last few days we've seen reduced hospitalization. Part of it could be related, we've seen sudden significant spike after the 4th of July. Holidays where it take about 2 weeks to see that effect, and it might be now we're returning to our level of usual admission and numbers. It's going to really take time to tell exactly. We always been talking about and preaching about physical distancing and masking. Can that have some effect? Is the community following it a little bit better? We're going to really need to wait and see. This is going to take probably 2 to 4 weeks at least to know how we're looking at this. I'm hoping it's good news, I must say.
We know that you play a role in managing remdesivir at Huntsville Hospital. As coronavirus cases continue to rise, do we have enough to continue to meet demand?
So at the moment, yes, we do. That we've been using it on a regular basis for those patients who needs it. It's really a matter of time. We're going to see if the numbers goes up, is this going to affect us? I can tell you, I have other colleagues in other states, for example in Georgia, and they're telling me they're running out of remdesivir because of increasing cases, for example, in certain areas. So we're going to need to see how this is going to go with our cases. We, again, trying to stick to certain protocol and adhere to certain criteria to use the remdesivir so we can use it at the best to the ones who really needs it as much as we can.
I've heard a lot of positive updates lately on vaccine development. Pfizer just struck a $2 billion deal with the government. They say they'll have 100 million doses by the end of the year. What do you think is a realistic timeline?
Yeah, I think still probably, if we are very optimistic, it will be the end of the year. There are several companies now have published or talked about their phase 1/phase 2 trials, and some of them are really promising. I think the concept of the corona vaccine has been shown it might be helpful, but really what we need to get is these vaccines going to prevent the infection or reduce the infection? And I can tell you, at the moment, we don't have that answer. We're going to need to wait for clinical trials to get an idea. And this is going to take time. It's going to take 2 to 3 months to get an idea of this. So I'm saying very optimistic. If we really get something, probably by the end of the year. Otherwise, it'll be next year.
Dr. Hassoun, there have been recent reports that a person's blood type plays a role in both their likelihood of getting the coronavirus and the severity of the symptoms they get. What is your perspective on that?
Yeah, so I've seen that, which was published in the New England Journal of Medicine. So this is one report talking about type A. Blood type A is more prone to severe infection versus blood type O. I always say, it's only one report. We really, to confirm this information, you need multiple data to prove that. Locally, we've been looking at it and watching it closely, and I can tell you we haven't seen that a difference between all these different blood types. So locally, we haven't seen that.
So I seem to remember health experts saying that when the hotter months came along, this virus was going to kind of go away. What happened to that?
Well, I mean, it was a wish, I think. There was some data talking about the higher temperature, it can reduce the activity of the virus. But look at it then. I mean, obviously, there's really not much reduced activity. It's all over. It's widespread. So, unfortunately not. The hot weather is not having any effect on the transmission currently.
Any final message to our community tonight?
Yep. I always really encourage our community and everybody who's involved to, take care of the public health, to think about we'll be able to do it together. We need to follow these simple guidelines of prevention because we don't have yet treatment that's a magic bullet. We don't have vaccination. So prevention is the best way. And by prevention, we always talk about the physical distance, the masking, the hand hygiene, you know, if you're sick, staying at home, if you expose, quarantine. And believe me, these works. These really works, but we need to go with it where we adhere to it very well. If we do it, we can really succeed.
Now, where do you see us going from here until we get a vaccine?
Yeah, I mean, again, I hope the community will follow these, because apart from if we lock down and try restart, and we've talked about that before, if there is no intention to do that, then we really need to do the other part of preventions. And we really, I mean, it's not that difficult. We're gonna need to rethink about it, because, you know, there's increased death rate, there's increased hospitalization, and imagine, it's simple things. We can prevent all this or reduce it as much as we can.
Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Thank you so much, Dr. Hassoun, for joining us tonight.
Thank you.